there are many exciting things that are happening in the field of sarcoma. So obviously, we're realizing that both phytogenetically and evolutionarily, sarcomas can be now classified into broad groups. And in fact, there's some very exciting work that came out of Dana-Farber, which helped us understand certain groups of sarcomas. Usually we would look at them under histology, so we would say they're more like muscles, they're rhabdomyosarcomas, they're more like fats or liposarcomas. But we're finding that there are certain groups of sarcomas that are closer to each other versus certain groups of sarcomas that are farther apart. And the reason that's important is because traditionally sarcomas were always considered, with a very standard paradigm, which is surgery, maybe radiation, and adjuvant chemotherapy has always been a little bit plus minus in terms of thinking about how well it works for sarcomas. But I think by trying to club these tumors together, we're able to kind of understand better how to treat them. I think there's amazing advances in imaging, so especially diffusion-weighted imaging, especially for retroperitoneal sarcomas, where we can actually use diffusion characteristics. As you know, diffusion-weighted imaging relies on the water content of cells. And it's remarkable for our ability to be able to detect some areas of malignancy versus not within sarcomas, and even potentially guide biopsies and potentially pre-treatment paradigms. I think the standard of surgical resection remains, paramount for patients with retroperitoneal sarcomas. But what is exciting is the fact that the concept of compartmental resections is being re-explored, and certainly appears to be attractive in preventing recurrences for patients with retroperitoneal sarcoma. So the concept that was abandoned in the extremity is now being re-explored in the retroperitoneum. So I think that's a very exciting surgical development where we're actually resecting more than just a sarcoma mass alone.